I'm going to talk about the craft of the graft, the gold and the other kids. Now, it's very strange that in a talk or a webinar which is entirely focused on instruments, I'm being asked to talk on the graft part of the whole thing. But this is it. As is our biology, so is our orthopedics, with a small help from biomechanics. Now, I think the grafts are the most powerful instruments available in armamentarium of orthopedic surgery. I'm not calling it the strongest because there will be enough discussion on the strong part of it. But I think by all standards, the most powerful things are the graft that we have. And in this talk, since the entire talk has to be only 7 minutes, I'll be kind of rushing through a lot of things. This topic may even 3 days would not be enough for this topic to be covered, but we'll try to cover it in 7 days. So we all know about the gold, which is the autograft, and then there are other kits which are there. And to us today, there are more than 300 graft options available in US. Many of them have evidence, and many of them do not have any evidence. So the other kits that I'm going to talk about is following 5, which are the bone marrow aspirate, bone morphogenic protein, allograft, synthetics, and I'll briefly touch upon newer developments in this. So these are, and I'll be just touching on things that are available to us here and which are relevant to us in our practice without going into the theoretical aspect. Before I move on to anything, this talk cannot be complete with this important slide. This is the most important Mona Lisa slide for all orthopedicians. So any healing trinity includes cells, growth factors, and scaffolds. So any graft to heal, it has to have an osteogenic potential, osteoconductive, and an osteoinductive potential. It's like driving a car from, if you want to reach from Mumbai to Pune, you'll need cars, you'll need highways, and you'll need fuel. So your cars are your cells, your fuel is your growth factor, and the road or the infrastructure is the highway. If only these 3 things are met, that we'll be able to reach to our destiny. Now, we all know about autograft. They are easily accessible and available to us. There are few pertinent points that we need to know. Our graft, especially if we are taking an anterior graft, has to be 2 centimeter away from the ASIS to avoid fractures and avoid any injury to the LCNF. We must avoid periosteal stripping. Standard thing, raise the pelvis by 30 degree. 5 centimeter incision is sufficient for most. Again, 2 centimeter posterior to ASIS. Minimize the periosteal stripping to reduce the pain. Your osteotomes have to be sharp. And the closure is one of the most important aspect of this whole procedure. You don't want any hematoma. So there are different series in which the autograft complications have been reported, and they vary from 5 to 26%. And I think this variation is because of the surgeon's technique. If you do it well, you can keep it under 5%. The next thing, and because the bone graft is quite standard and autologous bone graft is quite standard, I'll focus on the alternatives that we have and which are simple. So we are going to talk about bone marrow aspirate, which I think is it's a part of the bone graft, but at the same time, if we knew a few things and if we knew how to combine few of powerful instruments that we have today, and I'm using the word consciously, the instruments, because this talk is on the instruments, we can achieve what we want. So the first step in the bone marrow aspiration is to have all your thing rinsed with heparin solution. You can use 1000 units per ml of saline, and the recommended saline on table has to be 50 to 100 ml. And you can rinse everything that comes in touch with the marrow with this thing. The aspiration site could be anterior or posterior, and the direction is most crucial. You'll see this diagram that we have drawn, and one of the key thing is to hold the iliac crest and put your aspiration needle in the right direction. This is a small video. You see I have pinched the iliac crest with the hand so as to not let the thing slip. You will see that my one finger is supporting the needle so that the torsional force is reduced, and again it is going into a corkscrew like movement, and it is going in the direction of the iliac crest. So that's the correct way of inserting the needle, and that's the correct position to ensure the best heal. And that's the critical part, and that's the where the difference between a good, mediocre, and best lies. You have to follow a certain few principles when you are aspirating. Never aspirate more than 5 ml. These days we aspirate only 2 to 3 ml at one site. Once you have done that, either turn it, if you're doing it 2 ml, then turn it by 45 degree, 45 degree, 45 degree, and another 45 degree, or you can do 5 ml and 5 and 90-degree term, so that the marrow is not diluted with the venous blood. That's very crucial because that ensures that your mesenchymal stem cells or medical signaling cells and growth factors have the highest concentration. The second thing is also to have an optimal syringe pressure of less than 5 ml. So if you pull it too hard, the cells undergo trauma and they get destroyed. So it's important to have a good quality of bone marrow to yield the desired cells. So you'll see in this video that this is how you do the bone marrow aspiration. So once you have done that, you connect the syringe. Yeah. Now it's important that you are holding it at a not a great pressure. I could have pulled it up to 20, but I've only pulled it at 5. And you'll see that the blood has to enter gently and not with too much force. If there is too much force, one, there will be dilution, and second, there will also be trauma to the cells and they will be of no use. So this is how you collect a good bone marrow. Coming to the second most important thing apart from this is bone morphogenic protein. We all know about the contribution of Michael Uris. The bone morphogenic protein are one of the most important growth factors that are responsible for formation of bone. And trust me, this is one of the very powerful product. We have done a lot of animal studies with it. The currently available one is BMP2, which is the infuse. The other one, which is the OP1, which is by Stryker, has had gone into some disrepute, so it's not very commonly available. But these bone morphogenic protein, so in order of priority, as I said, the bone graft is the gold standard. The second is the bone marrow aspirate, and this third is the most important, which is the bone morphogenic protein. The only downside of this is cost. I have had experience of using them in transgenic mice. We have done a lot of basic science experiment with this, and this is the JBJS paper that we published. And trust me, these are so powerful that if you inject in subcutaneous tissues, you will come out with growth. We've done that in bunine models, and we have found that there is enough evidence of these being superpower thing. The next in the line of hierarchy is allograft. This is the standard Tata allograft that we get. Used alone, this do not serve the process. Now for allograft, there are few things that you need to do. These are dead bones. So there are two things that you have to do, and I borrow from Hindu scriptures. First, you have to do a Shuddhikaran, and the second, you have to do Pran Pratishta. By itself, they have no meaning. So the first step, whenever I decide to use an allograft, is to open it the very moment, even before the scrubbing has started, and put them in Vanco and Genta saline. Then I proceed to harvest the bone marrow, which you're seeing on the thing, and it will depend on amount of graft that I required. So the amount of marrow will vary. So for example, if I'm using a less marrow, less a small defect, then we'll use less amount of marrow. So by the time your marrow is harvested, it's already half an hour, and your graft has been in the antibiotic solution for that long. That reduces the infection rate. And then you morcelize the graft. And this is again a small video. This is a recent case that was last week done in my institute. And you'll see that they look almost like a autograft. So once they have been done in proper thing, this is used to for a distal radius surgery from a dorsal approach by the hand surgeon here. And this is how the grafts are put. They almost look like autograft and also behave like autograft, more importantly, if done properly. So if you look at the circle that I drawn, the allograft have osteoconductive and some degree of osteoinductive properties, whereas the marrow has got osteogenic cells as well as osteoinductive properties. Coming to the final end of this, which is the synthetics. Now there are different variety of synthetic available. The most and they differentiate from the absorption thing. So if you look at one end of the spectrum, we have got the slow mover, which is tortoise, which is the hydroxyapatite. Then is the tricalcium phosphate, and we progress toward the fast dissolving one, which are the calcium sulfate ones. So quickly, I've already heard a bell. So ones available are Chronos. This is again tricalcium phosphate. The Allogran is with biocomposite. There are two ones which are tricalcium phosphates. Again, the G-bone has pure hydroxyapatite. The Stimulan is the calcium sulfate. So these are the common ones available in India. The Zimmer has a biphasic one which has got both hydroxyapatite and tricalcium phosphate. Again, they come in different ratio, 60, 40, 90, 10. If you want a delayed absorption, you will use a hydroxyapatite more. And if you want a faster absorption, you will use TCP. And fastest absorption is calcium sulfate. Again, this is Tripor, tricalcium phosphate. So the the take-home message is the gold still holds the fort. So that means the autograft is standard. Technology and more importantly, our understanding with the regeneration potential of body is improving. It is, and if we have to replicate what the body does, it has to be a teamwork or rather be an orchestra. And we must remember that both instrument and players are equally important. If you ask how can we beat the returns of gold offer, and this is both theoretical and philosophical, this is from stock market. If you look
I
at
think,
the bottom line, this is the gold, and I think I have 1 more minute, right?
yeah, I think, no, I think you have
Uh,
overshot.
Yeah.
So
Okay.
right.
Okay, so that's the orchestra. This is the surgeon. And again, this is the ikigai of regeneration, where you have to have mesenchymal stem cell, growth factors, and scaffold. I thank you for your attention.